Estrogen cannot stay in your body forever. As much as we love estrogen, it does have to go through detoxification. And there's been a lot of research lately and in the past around how your GI tract, being the phase 3 of your estrogen detox, plays a major role in what your hormones do. Hi, I'm Dr. Carrie Jones, women's health and hormone expert, and I fully understand hormones can feel like herding cats. So you're going to want to hit that subscribe button so you can learn as much as possible about what's going on in your body. But today we're going to talk about phase 3 estrogen detoxification. I'm going to explain what it is, what screws it up, and then what we can do to get it back. There was a paper that came out in 2023. In fact, it's titled, I have it written down here, Gut Microbial Beta-Glucuronidase, a vital regulator in female estrogen metabolism. What that fancy word means is an enzyme in your GI tract, in and part of your microbiome, plays a vital role in what you do and don't do with your estrogen. So when you make estrogen or take estrogen, if you're on hormone replacement therapy, it can't hang out forever. So it has to go through a detoxification process. And I align it to something like the bathtub in a house, maybe your house or condo or apartment. You have water coming in the bathtub, that's phase 1. You have the drain of your bathtub, that's phase 2. And then you have the sewer line to your bathtub. So it's taking it away out of your house and getting rid of it completely. That's phase 3. Think of that like your GI tract. Think of that like it's all happening in the liver, and then we have to get rid of it, eliminate it, so it gets pushed into your intestines, and then out it goes. Out in the poop, out in the stool. Now, in this part of your intestines is an area or a conglomerate of bacteria known as the estrobolome. And it's basically estrogen, microbiome squished together. So it is the bacteria that are responsible for breaking down or not your estrogen further so that you can get rid of it out of your body. If your estrobolome is out of balance, then it can make a whole bunch of these enzymes called beta-glucuronidase, and they act like scissors. So when estrogen is coming through and detoxification is happening, basically your body has to make it water soluble. So I say it puts it in a box, it puts the lid on, it puts a bow on, and sends it out through the intestines. Like, let's get rid of it, let's drop it off in the toilet. But if you have a lot of these scissors, a lot of beta-glucuronidase, it's going to cut off the bow, it's going to undo the package, and estrogen will fly free. And when it flies free, you can absorb it back into your body. And this is estrogen that your body has said it's time to get rid of. We don't want this anymore. It's like you piled up all your trash at the front door, took it out to the street, and then somebody brought it all back in. Like, you don't want that extra trash back in your house. This plays a role, research says, in things such as PCOS, endometriosis, PMS, estrogen-related cancers, and more. So it turns out our GI tract, our microbiome down there, our small and large intestines play a huge role in our female hormones. Now, how do we screw this up? This is the microbiome. So the microbiome can be screwed up a lot of different ways. It can be screwed up from our oral health because we have a microbiome in our mouth. If it's been a while since you've been to the dentist, if you don't floss very often, if you have a lot of like periodontal disease, gum inflammation, every time you swallow, you're swallowing maybe bad bacteria, infection, all the way down into your stomach, into your small and then large intestines. So that's the very first thing. Check your oral health. The second thing is alcohol. Believe it or not, alcohol intake can disrupt your microbiome. So paying attention to the alcohol that you do consume. Next, we have antibiotics and certain antimicrobial, even think of like hand sanitizers. If you accidentally ingest that somehow, anything antibiotic, antimicrobial will do exactly what you think it's going to do. It's going to kill the microbes, which includes the microbes in your small and large intestines. So if you regularly have to use antibiotics, just make sure you're doing all the healthy things I'm about to say to help your microbiome back. But if you're doing antibiotics or getting exposed to antimicrobials that maybe you don't need, maybe it's just a safety fallback plan for taking the antibiotic, you're doing it just in case, but you don't really actually need it. And there are cases, some people are on long-term antibiotics that maybe do or don't need to be on it. Maybe it's a viral issue, but you're taking it. And of course, antibiotics are for a bacterial issue. So it's not really going to help the viral situation. So it's either way, it's affecting your microbiome. And as I said, there's ways to get it back if you have to be on and antibiotic. If there are foods that you are exposing yourself to over and over that you know you're probably allergic to. So if you know every time you have dairy, you have cheese, you have a mocha or a latte, you have ice cream, it just destroys your stomach. That's causing a lot of inflammation and can be negatively impacting your microbiome. So be very careful with that. Now, how do we get it better? How do we improve our phase 3 detoxification? Obviously, I talked about the oral health. We want to brush our teeth, make sure we're flossing regularly, even consider doing tongue scraping, see that dentist regularly, make sure the gums are not inflamed, you don't have periodontal disease, and you're not routinely swallowing bacteria that's unhealthy from the mouth down into your small intestines. Then again, as I said already, alcohol, you want to be mindful of alcohol intake. Third, we want to look at your food diversity. Your microbiome likes to be diverse, believe it or not. It wants to have many of the good bugs, the good, kind, joyful, fun bugs that are helpful to you. Remember, your microbiome plays a big role in absorbing nutrients, in making neurotransmitters, even in making hormones. Your microbiome does so much, and we have trillions of bacteria and such in our microbiome. So we want to take really good care of them. Food diversity plays a big role. So if you find yourself eating the same thing every day on repeat, you're going to want to think, maybe I should try something different. Maybe I should break this rut. Maybe if you only eat chicken, you need to try something you don't normally eat. Turkey, buffalo, right? Bison, add in some more meat. If you are only eating the same vegetables every day, apple, fruit, carrot, vegetable, and you kind of just rotate that, celery, banana, let's diversify. There's so many great options out there. When you go out to eat and you order the same exact thing every time, no matter what, maybe try some diversity. Your microbiome will thank you. And thankfully, the microbiome can shift very quickly in a very short amount of time. Now, the next thing are prebiotics and resistant starches. Now, you can actually buy resistant starch as powders that you can mix into smoothies or drinks, and you don't even taste them, but they can be really helpful. But you can also get them as foods. So some of my favorite foods are jicama. That's jicama, starts with a J, and it's very crunchy. It's very slightly sweet. I actually drizzle olive oil and sea salt over top of it, and I love it as a crunchy treat. Apple pectin, asparagus, leeks, onions, green banana, a greener banana. So if you do eat bananas in rotation, instead of getting mild or super ripe, try for a more green. And they do also have green banana resistant starch powder out there that you can add into your foods to get a little more resistant starch, that prebiotic. And the prebiotic helps feed your bacteria, your microbiome, which leads me to your probiotics. Eating things such as fermented foods or low sugar fermented yogurts, kimchi, which is one of my absolute favorites. You can even take probiotics as a supplement. And then we have postbiotics. Postbiotics are actually kind of like what your bacteria, your probiotics release and get rid of. And the most common one is called butyrate. And we like butyrate in our organic butter, but not everybody can do butter and not everybody does a lot of butter. So you can actually take butyrate as a supplement as well, sort of rotate in a little more organic butter if that works for you, or even as a supplement. Now, speaking of supplements, there is some great research on the supplement berberine. Berberine can be helpful. And then, of course, what's called calcium deglucarate. Calcium deglucarate helps keep the lid and the bow on the box of estrogen. It kind of blocks the scissors that are happening so the estrogen can properly get excreted out of the body. HRT, hormone replacement therapy, specifically estradiol, plays a huge role in the microbiome. There is now a lot more research on the declining estradiol and the impact, the negative impact it has on the female microbiome. It can actually worsen our risk for infections. It can worsen our risk for heartburn. It can worsen our risk for leaky gut, constipation, diarrhea, bloating, just because estradiol plays such a big role down there. And so if you do choose to go on HRT, if you choose to go on estrogen, estradiol in particular, that has been shown to also be helpful to shifting the microbiome back, the whole GI tract back, with all the other foods, etc. So I hope this was helpful. I hope you now understand that when we talk about phase 3 detoxification, the estrobolome, the estrogen microbiome, We think of it like the sewer line, right? It's the last line out of your house, just like it's the last line out of your body. And there are a lot of really great ways that we can absolutely modify it naturally using foods, using prebiotics, probiotics, postbiotics, using some of these fiber supplements that are specifically resistant starches, even using estradiol and HRT, if that is something that you are considering, supplements like berberine, calcium D-glucarate. Now, last question, can you test? Let's say you're thinking, well, can I just know what's going on in my GI tract? How do I know what to choose? You can test. There are a number of functional stool tests available that do look at some of these markers. Now, the controversy is there's a lot of research on the marker, beta-glucuronidase. There's a lot of research on this area, the estrobolome, but it doesn't seem like anybody can really agree on what's a gold standard. And so that's the controversy. So do know, I do like the functional stool tests. There are several of them out there, but in research, you will find that they really can't agree on a gold standard or on reference ranges, except they're also doing the testing in the study itself. So if your practitioner suggests doing one of these stool tests to gather this information about you, it can be really helpful, I find, especially in the patients that I've seen, and in helping determine what would be best for your gut health and for phase 3 detoxification. So thank you again for listening. I hope you understood now the importance of food diversity, pre, post, probiotics, all the support in your sewer line, your intestines, the estrobolome, and now understand how that all relates to your estrogen and how we need to get your packaged estrogen out of the body in a healthy manner. So hit that subscribe button. We're going to be talking about this a whole lot more.